John Thune joins us. Good evening, sir.
Good evening, Greta.
And what do you think about Mr. Emanuel's statements to my colleague, Chris Wallace?
Well, you know, it's funny. They keep sending these people out to shill for this really bad law, and I kind of feel sorry for them because the mythology they're trying to create about Obamacare is very different from the reality that most people are experiencing. And when you say you can keep your doctor if you're willing to pay more, that's a very different statement than you can keep your doctor, period, which is what the president said.
Well, actually, I thought when I heard that, I couldn't decide if I thought that was arrogant or if he thought that we Americans were sort of some sort of social experiment in a petri dish. You know, they didn't understand that, you know, American people, for the most part, you know, having to pay more means a whole lot to a lot of people. Maybe not to the people who make a lot of money, but to a lot of people. And I was surprised when I heard that.
Well, when you get outside the Washington bubble, I mean, I was just reading today some of the emails and letters that have come into our office. I mean, these are incredibly real and profound impacts on people's lives. I mean, we had a couple that had sent in, said that their premiums were going up by $400 a month. And,
that's a lot of money.
And the deductible's gone up by $1,400. He said, I just feel like the federal government just stole $5,000 from me. And we had another couple that was looking to buy a home or get a bigger home, and their insurance premiums went up by 232%. And so
but
they
see,
said,
I mean, I think what I find even worse, though, is sort of the arrogance of, well, you know, that's not what we really said about it. You know, if you want to keep your doctor, you can. You just pay more. That's what bothers me. There's no sense of empathy, like, you know, to say, look, I get it. You know, we're trying to fix it, or I'm sorry it happened, or, you know, I wish I'd told it to you straight, or I wish it. But I don't get that. I guess, like, oh, well, you just pay more.
Well, you know, the funny thing about it, too, is you would think that people would be more empathetic to how this impacts middle-class Americans, because it really does hit the middle class the hardest. I mean, people on the lower income scale are going to get some help through the subsidies. Obviously, people in the upper end can afford it. But if you look at what it's doing to middle-class Americans, and the president last week in an interview tried to blame somebody else. He said this isn't about his management style. He said it's kind of an indictment of agencies that are outdated and not designed properly.
Well, he also said it was groups like this young man's group
well,
was just here that said they're out to sort of discourage people from doing it.
Well, you know, and the thing is, I mean, he essentially said that big government was the problem with all this, and yet he's trying to dramatically expand the size of government with this thing. I mean, this is really it is a government takeover, 1/6 of the economy, and the real life implications of this for most people are, as we found out, canceled coverages, sticker shock in the form of higher premiums and dramatically higher deductibles, and obviously tax increases that are going to lead to higher costs for other things.
But you bring up when he spoke last week, he also said last week that the Republicans didn't have any alternatives, and frankly, that was just false.
Right.
Because he may not like the Republicans' ideas. Maybe they were bad, but you had Ryan, you had Price. There were alternatives out there, but he just says that, and he can't possibly believe that. You know, he may not like them, and they may be bad ideas, but that's just a lie.
Well, I don't think they're bad ideas. I think this is a really
no, but you understand my point.
No,
And that's the arrogance that
right.
I don't get. Is that, like, you know, if he doesn't like it, they dismiss it even exists.
Right. Well, and I think that at least in their world, there's one way to do this and only one way to do this, and it's Obamacare. And it's a failed system built upon a faulty foundation, and now we're seeing the real-life impacts of that. But there are Republican ideas that are out there. We have a lot of members who would love to have an opportunity to debate those if we could get that chance. But it means that the president's going to have to acknowledge that this isn't working and go back to the drawing board. And we would be more than willing to enter into that discussion about what we can do to address the high cost of health care in this country, because that's what, for most people, this really comes down to. Well, it's a cost issue. It affects, they can't pay the rent, they can't pay the mortgage, they can't put in their children's education.
But they don't even acknowledge, if you send your lieutenants out here to say on television, if you liked your doctor, you keep her, you just have to pay more, it shows that they so don't get it.
Well,
you know, I mean, that to me is appalling.
Well, there's a hubris and an arrogance has been associated with this from the beginning, and it started when they passed it with all Democrat votes. They decided to do this on a strictly partisan basis, without input from Republicans, and they passed a law that I think in their world, in their theoretical world, was the solution that they thought was going to solve this, but clearly it's not.
But then we go back to my original thesis, you know, the arrogance, and you know, in a democracy we're supposed to work together, have new ideas, exchange ideas, but if it's like, you know, if they don't understand what most American people are going through, if they're not even talking to the middle class, find like $100 more a month on a premium to a lot of families makes a difference.
Well, and they ought to read the emails and the letters coming into our offices and the phone calls, because these are real life examples, and these impacts on people's lives are profound and going to be felt for a long time, because people have to make choices, hard choices about whether to spend money on, or much higher premiums, much higher deductibles, or whether or not they're going to be able to buy the bigger home for their family or put money aside for their kids' education.
Senator, always nice to see you. Thank you, sir.
Nice to see you, Greta. Thanks.
Well.